Welcome back, your Feel Good Breakfast Show, live on SABC3 on this Tuesday morning, and that time of the morning when we talk all things health with Dr. Darren Green. And we said we'll take a few questions from you on social media, on Facebook. Let me just quickly enlarge this so that you can see it quite nicely. From Kolelwa, who says that one of the biggest problems that she's had is with her lower back that's been so sore, and she's used all kinds of painkillers, but she finds that lying down on her back straight on the floor helps a little bit. What would you have to say to that, Dr. Darren?
Yeah, so a lot of people, when they do have a bit of a back issue, they lie on a hard surface, like a wooden floor or whatever, and it sorts them out. Often what happens when you put yourself into a neutral position on the floor like that, you can imagine you have then the chance of the facet joints to realign.
Yes.
Where some people, the soft tissue and the size of their bodies and so forth might need assistance with that, where you'd need to go to, for example, a chiropractor or a physiotherapist to help you align the spine again.
Yes.
With the facet joints. So lying on the floor often helps people for a specific time. Like the old days, we used to do traction quite often, and not even in the old days, sometimes we still use it, where because of the pressure and inflammation that occurs as the nerves exit the spinal cord, you have then pressure on those nerves. So people lie on their backs flat in hospital with their legs up in the air in traction. You know, pulled out. It opens up like a concertina. It pulls the vertebra apart, so there's less pressure on the discs, and the space can reduce inflammation and create more space for that nerve that's exiting.
But I guess it's about discovering why exactly that pain is.
So for her, one would know how long has she been suffering with this pain and her age, etc. Once again. But we'd also want to look at some practical things in her life, especially at a young age. What's going on at home in terms of what she's sleeping on, what shoes is she wearing, is she doing sport, what kind of sport is she doing, what techniques is she implying when she's basically doing a gym, etc. So we'd go into an in-depth history.
All right, let's quickly take a call. Lillian is on the line. Good morning, Lillian. Hello, Lillian.
Hello, Lucas.
Ke teng ona o kae o swa ka?
Ke teng, ke Lillian from Nelspruit.
Okay, also Lillian from Nelspruit. What is your question?
Nna ke na le bana ba i3 ne ke ba kry-ile ka cesarean, and then o tloga moo ke na le back pain e le mo hara spinal cord. Nkare o na le hole so. And a ke kgone le o benda. Sometimes ke ditsa bana ba binele ka mo morago ka hobane I tsamaye.
Wow.
And then my right leg ona je ko a libereke sentle a ke khone ko re le ha ke driver le ngfala nkare di myself a di sa sipila sentle.
Okay, so what we have here is a situation where Lillian has had about 3 children, and the pain she's feeling on her middle back feels like there's a hole there, she says. And even when she drives, and she wears heels, and she feels like when she drives, her right leg's muscles don't feel like they're working properly. So I'm assuming a certain kind of numbness that's happening there.
Yes.
When you connect all of that information, does that...
Certainly. I mean, one would consider when you have unilateral pain radiating from the back, the first thing that we often think of is related to disc herniation. You know, you hear people say, I slipped a disc.
Yes.
And that means the actual cushion or disc between the vertebrae can move and shift due to an abnormal posture or movement or overstraining in a certain position, with then compression on the nerve root that exits the spinal cord and goes down that leg. You'll hear people speak about sciatica, which is obviously an electric shock-like pain that goes down the leg, for example. You also have sensory loss, so the skin might feel different when she showers or baths, loss of sensation and sensitivity to touch, but then weakness of certain muscle groups that affects her walking and gait and style. That also needs to be looked at. So certainly, with a history of 3 children, one would want to know, has she worked on developing and strengthening the core muscles again?
Oh, right.
Because after, it depends whether you've had natural birth or cesarean sections. You must imagine you also then need to repair and strengthen the muscles that have been cut while gaining access, obviously, to the abdomen. So one would have to build that up and strengthen your core again. But certainly she sounds like she's got significant mechanical back pain.
Absolutely. And I'm just kind of finding this quite interesting, because another question that came here from Belinda also related to the fact that she's had 4 to 5 children, and then she wanted to talk about back pain relating to that. So there is a thread here. So let's quickly talk about good back hygiene and the kinds of exercises you should be doing at home, perhaps at the gym, to strengthen all those parts that support your back.
So maintaining good posture and looking after the vertebra involves good bone health. So your calcium content, your phosphate, etc. is also very important. If you're going into your late 40s, menopause, and looking at that, the effect of that on bone quality is also important. Your thyroid gland also has an effect. Lifestyle issues, your bed, you need to look at the bed you're using. Is it a good bed for you? Do you need a firm mattress, a soft mattress? What's your weight? Are the springs or the memory foam intended for someone that weighs 100 kilograms or more? Seek expert advice with that. When you do activities and you're wearing shoes, do you have collapsing arches? Do you have flat feet? All that plays a role with lower back pain. Looking at things like the cushioning and the shock absorption, and obviously when you're running up hills and down hills, whether all that is distributed evenly, and we need that. And then, of course, prevention through core exercises like Pilates is essential. I can't tell you how many people, even post-op, even after they've had back surgery with pain, they end up doing, strengthening their core with exercises specifically aimed at the abs and Pilates, how that assists in reducing the amount of pain medication they need to use.
Yeah. Okay, Dr. Darren Green, always appreciate your contributions. Thank you so
Pleasure.
much for your calls. We appreciate your contributions to our topics. And, he's not just a doctor by name. He can always back it up with the information that he's got too. Let's quickly go over to the kitchen. And I know that Zola has been attending quite a few weddings recently, and she's quite the extraordinary dancer. You must be careful when Zola. You'll break the back, eh?